Good evening. I hope you can all hear me well. Tonight we have a talk by Tom Gilb. It's sponsored by the Quality Specialist Group and the Business Change Specialist Group with SPA. I'm doing the introductions instead of Sohair, who is on board, but unfortunately doesn't have the working equipment at the moment to do this. So this was actually arranged in advance of the time when we had the training course back in May and early June. So it was in April and May, wasn't it? And also ahead of the talk that we had on the 1st of April. So you're getting a real feast of Tom Gilb this year. I'm very, very grateful, Tom, that you've been able to leap into the breach and fill so much of our program when other people were unable to do so due to the COVID-19. Without further ado, I'm now going to hand over and sit back and enjoy this talk. 1 second, Tom. Yep.
The specialist groups.
You're on.
Sponsorship. Okay, so number one, if you want to take a photo of the first slide, you would get a lot of links, including the link to these slides, which you could download right now, and the link to the book we've promised you on 100 Practical Planning Principles. You also find these links on the last slide, and maybe the specialist groups will put up the links if necessary, I don't know. But there they are anyway. Okay, I'm here near Oslo, Norway, and I want to congratulate the women on the Women's Engineering Day, and I'm hoping that since the male IT engineers aren't very good at engineering, maybe some women will step in and take some leadership in engineering. Public planning, which is what I'm going to suggest. Quite a shocking idea, right? Civil servants as engineers. Let me know what happens. I'm going to ramble on. We can be interrupted by short questions and short answers for an hour and a half, and then we'll have a further up to half an hour for questions. If anybody wants to ask questions in a more subtle way or later, there's my email, tom@gilb.com, and I'm quite happy to talk with you, supply additional materials, clarify things, whatever, just good fun. Okay, so let's see. The talk is divided into two parts. We have about 89 slides. I think it's 23 seconds each. So, and the slides can be quite busy, so I'm not going to read every detail on the slides, but then on the other hand, when you want to review later, you've got enough text to piece things together and figure out what I'm trying to say. This is not intended to be read, it's just a list of some of the problems I find, and I'm going to do them one at a time with 1 or 2 or 3 slides per problem to illustrate them, so you'll get this all in detail. But this is just sort of the overview of the public planning problems I find. When I've disheartened you about all the problems or got you to recognize that you probably have these problems too, I'll do the second half of the talk, which is some positive principles for public planning. In other words, the problems are a bit negative, although I'll throw in a little bit of positive encouragement. And but the principles are positively how I believe public planning should be done better. So starting off with the first problem, which will surprise no one, if public plans, let's say they consist of objectives, what the public institution wants to do, and strategies, how they want to do it. If these are unclear, if these are ambiguous, if these are missing lots and lots of necessary detail, then we have a bad plan. And I'm afraid that all the plans I see, both privately as a consultant and publicly by picking things off the internet, for example, the whole National Health Service planning and much government planning is there, they disappoint me greatly. In fact, it's embarrassing that grown people publics plan so badly in public. And I'll illustrate that with some practical examples. So our biggest problem is that we don't seem to know how to write a clear objective. So everybody will misunderstand it in their own way and feel quite comfortable with that, and then push on with strategies which in fact are equally unclear. And then they will implement those strategies and subcontract with those strategies and waste billions of public money and years of time, and perhaps kill a few people inadvertently in the process. This is just for fun, but this is lies per day by a certain US president. So a lack of clarity in public planning sometimes starts at the top, probably with all politicians, but maybe there's some nice exceptions. Here's something from the Department of Works and Pensions, which I messed around with a little bit. And here's a list of the critical value objectives that we could derive during a conversation and from their posters they had. First thing you'll notice it's all words, words, words. Nice sounding words so the public can understand it. Well, at least so the public can misunderstand it. And I'll show you what we took one called benefit dependency and said, could we clarify this, if only for internal use, not necessarily for the general public? What do we really mean by that? We'll see that in a minute. Now, in my papers from the Department of Works and Pensions, I bumped into this employment contract thing, the Civil Service Code. And I assume that applies to the whole UK civil service and maybe other civil services. And it basically says that we ought to do an ethical, professional, proper job. And if you don't, you may be guilty of maladministration. And frankly, everything I see is improper, unprofessional, and I think has to be characterized as maladministration. And I hope I get somebody very angry about this and wants to have a big fight about it. I will participate in the debate or the fight or whatever it is, but what's going on, and it's not a British problem, it is an international problem, and it's not even a civil service problem. It's a problem of how we train people to plan, for example, at business schools. So the same problems are rampant in industry and non-public service, but I'm going to focus entirely on civil service and public service things here. But anyway, keep in mind, the things I'm pointing out here are, in my view, improper, unprofessional, and constitute maladministration. And I'd argue that in a court of law. And I think, hopefully, I'd win. Now, here's what I promised you. We took as an experiment at the Department of Works and Pensions benefit dependency. You know, we don't want too much benefit dependency. People should be encouraged to go out and go to work and everything like that. But that's all it said. I mean, they had nothing deeper, except they did have a list of strategies of things they were going to do to reduce benefit dependency. But there's no point, as I shall point out many times during this talk, having strategies for an unclear objective. Okay, you cannot judge whether those strategies are appropriate or effective enough or anything or worthwhile. So that's my first message here is that the objectives must be clarified. Now, how do we clarify? Now, I'm using a language I invented and give to the world for free. It's called Planguage, planning language. And what we do, in very simple terms, we quantify critical values and variables in all qualities. Okay, we put a number on them. A little bit less oversimplified, we structure the ideas. So here's an idea that says, this is the permanent long-term name called the tag. It's amazing the quantity of public planning I find that has, you know, bullet points like these, but there's no name to refer to a proper, more detailed definition if you'd want to. There's no cross-reference. And I think the messiness of our specification starts with the lack of a tradition of assigning a permanent, stable name to the objectives and strategies. Now, the ambition level is another part of the structure. What that is, that's actually the badly formulated political soft things the nice things. You could call this management bullshit, for example, if you were less polite. You call it a headline, which one of my banking clients like to do. And I call it the ambition level. It sounds very good. So instead of criticizing and saying this is highly ambiguous and difficult to understand, we just take it as read. We may give the source, which could be a minister or a law or something like that. We write down the ambition level, but we do realize that this ambition level has so many ambiguous ideas, like, you know, which benefits, what kind of dependency, what kind of people, and what is at present, that it is fairly useless as it stands. It is not useless as a departure point and a summary. But what are we going to do to make it more useful? Well, we write a parameter of definition. We're now structuring the objective called scale, which is short for scale of measure. And this is sort of like miles per hour or bits per second. And that scale has to unambiguously define a variable, the quality of the objective, the value of the objective, and in such a way that I can put numbers on the scale. I can put a number for how bad things are at the present moment. This was in 2011. And I can put a number for my goal for example, handicapped and single mothers and in 4 years time. The goal is 4 years. The deadline is the next election. And I can have another goal for other circumstances. Let's see, here we had employment seekers benefit. Yeah, this is next election plus 5 years. So it's a different time frame. So short term, long term. But I can put a number for a set of subparameters describing exactly what this goal is for and what it's not for. And you can begin to see how we're getting more and more specific, more and more well-defined. And I'll show you a lot more of this. Here's another additional piece of information that deserves to be connected to any set of objectives, and that is, who are the stakeholders? Who is it who's behind it, who cares about it, who values it, and it'll give you a hard time if you don't achieve it. So, so structure is a list of pieces of information, data elements, you might like to call them, about the requirement, all under the heading of a stable tag. And this is a living entity and can be added to and adjusted and improved as you go along. But we're moving in the direction of completely unambiguous and quantified, measurable, nobody can misunderstand. You don't have to show this to everybody, perhaps not the general public, but certainly people who are going to put out million-quid contracts should be aware of this, to take one example. Problem 2 is completeness. In other words, I already hinted back here that you know, we should be complete by quantifying. That's a form of completeness. The other is we should be more complete by indicating who are the stakeholders for that. So the now completeness means there's for any given type of objective or strategy, there's a certain set of things that should be there so that we can manage the objective or the strategy properly. We can understand its risks and its priorities and change and things like that. And so how do you make sure things are complete? Well, first somebody has to decide what complete means. Here's a simple little list of the kinds of things I'm talking about that people often forget or don't have at all about a requirement or a strategy. And so, and one way of formulating it is we have a standard. I'm calling it a policy here for the moment. I usually call it rules, which quite simply lists the kinds of things we're expected to do in, for example, a requirement or objective, and how we're expected to do it. So there's a standard that, and we check that when an objective is written fully, the full version, it indeed contains all these things. Otherwise, it's incomplete, we're missing information, and we can't do our job properly. Here's a civil servant in Britain. I met him at the barracks next to, was it Wellington Barracks at near Buckingham Palace. And he was planning the communication kits for the Ministry of Defense. And Sorry, I'm mixing up with another general we're going to meet. This is Jeffrey Cliver of United States Air Force Testing System, and I suggested this policy for him and quite a few other things, and he liked it so much he gave me a little plaque with my name on it and his name on it. And this is my symbolic way of saying some top people in civil service really like these ideas. Although what we've found is that the greatest acceptance and will for the new ideas is at the top, and middle people don't much care as long as they can feel they're doing what they're told to do and collect their pay, which is unfortunate. Wouldn't it be nice if everybody was idealists and was always seeking to do the right and proper thing and not afraid of doing it even if nobody's asked them to do it? But that isn't the way things work. So getting support at the top, who more or less orders people to do it this way, is a helpful way of getting better planning. So let's just think maybe, you know, the ministers need to take a position on this, or the top civil servants above all. I mentioned briefly standards. I mentioned that policy, rules. So I have a set of different types of standards and lots of examples of them in my competitive engineering book, which I'm give you a free copy of right down there at the bottom. There's a link, and you can see all these things in practice for planning in general. Now, here's an example of quality control of a plan, in this case, requirements. And this happens to be at Intel, which has over 20,000 engineers trained to use my methods. And John Terzakis does research on how well they work and publishes it and uses it in practice. What he's done is he takes a set of objectives, the requirements, and he uses a practice called specification quality control, which I've developed. And you get details of that, for example, down at this link and other places. And in very simple terms, what we do is we go through the objectives and we count deviation from rule compliance. In other words, if the only rule is it should be unambiguous, we just count all the ambiguous words, and those are defects. They are unintelligible. We're not sure which of the many interpretations is correct. And that gives us a defect count. So for example, if we have a page of 300 words and 100 words are ambiguous, which is a very common occurrence in public planning, you'll find, then we say, well, is a page of a serious plan for the COVID-19 practices with 100 things to be misunderstood by the general public and civil servants, is that good enough? And hopefully you'll say, you've got to be kidding. You know, maybe one of those misunderstandings could kill a few people who then malpractice the standard for social distancing or whatever you want to call it. Now, what my clients do, and here's Intel, is they take the requirement or the set of objectives and they measure against their standards, which are pretty close to the Air Force ones I just showed you. And they say, aha, your deviation, your defects per page are way above our range that we find acceptable and cost effective. So we will not exit your document. That is, it will not be approved. It cannot be published on a government website. It cannot be shared with a minister. It's just faulty. And people get a bit annoyed at that. And but they are told we have to have some rule following here. You can't just arbitrarily write 100 unintelligible things in a major plan for the nation. And so people get back and try to learn how to write clear technical or management specification. And they actually gradually learn, very quickly learn, and towards the end of a learning cycle, maybe 4 or 5 cycles of learning, they get down to the green area here where there are often 50 times better, 50 times fewer ambiguous words, to take a practical example. And we're not going for perfect or infinitely good, because that would take forever. But there is a level where we can suffer one ambiguous word in a 300-page plan, and hopefully we'll catch it later somehow, even if it's a question from a journalist to the minister. What does that mean? But we can't. The minister can't answer 100 questions of ambiguous words when making a presentation of the plan. Anyway, so that's there's much more detail on that quality control process of making sure that the documents are intelligible, and that's our first problem. So problem 2, completeness, continued. And what are the consequences of incompleteness? And the answer is everything goes wrong with our plans and our planning. And here actually, that's my opinion on the left, but this is another opinion of somebody who's taken a look at it in more depth. And we more or less concur that sloppy planning leads to government failure. Okay. Now, why is public planning incomplete? And the short answer is because people aren't motivated to make it complete, and they aren't even taught what complete means. They aren't even given a simple list of complete, what they have to be complete. So they lack the knowledge, they lack the motivation, they lack the training. I mean, we really haven't addressed this problem of deciding what is complete and making sure that our planning is complete. But why? Well, I mean, who gets rewarded for being complete? And there could be some political interference that says, I have to have this yesterday. I don't want to hear that you need 2 weeks to make it complete. Let's, you know, there's a crisis, that kind of thing. Okay, problem 3, connections. Now, I already referred to one. Every objective, by definition, every critical objective has at least one critical stakeholder. That means stakeholder means they care about, they sponsor, they want to determine the level and definition of the objective. And now we have to connect stakeholders with their objectives. And take a look, now here's a real NHS plan, top level. And it says here the NHS will respond to different needs of different populations. Now, who are the stakeholders there? Well, we can probably guess that populations, whatever the heck that is, and decompose it. But it doesn't say, does it say anything about the hospitals and nurses and doctors? Not directly, although maybe they're in the population. So in other words, this is not, and there's no little footnote saying, if you go to this footnote, we'll show you all the stakeholders. In other words, what we're normally getting is statements without connections to things they need to be formally, digitally connected to, so that people can do things like ask questions, have we understood all the stakeholders for this objective? And have they been asked whether they like this objective or would object to the objective? That kind of thing. Sometimes you use stakeholders as a little specialized committee for one objective, so they can respond to it before you start planning expensive strategies or rolling out the objective without them hearing about it, being consulted. So here's another example. This is a National Health Service again, and I wrote down a list of questions. You know, exactly who is the stakeholder for that, and who are the stakeholders for that, and what if two stakeholders are in conflict about that objective and have different opinions? What are you going to do about that? And there's a whole lot of common sense questions we should be able to ask about a plan before we publish it and set it in stone. So this is again another example of a lot of blah 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 planning without there's no notion of a footnote or references or see this and that. It's just sort of there. There probably is additional information about some of this here and there if you read the whole 100-page document and search for it and guess what it means, but it's not very clear exactly what is connected to what. This is like an old style of planning with ink, quill pen and parchment, and we're in the digital age where we ought to easily be able to digitally connect any one requirement with 10 or 20 interesting connections, like the sub-supplier, the person responsible for it at the ministry, the stakeholders, and things like that. Problem number 4, sort of halfway, look at my watch here, is value quantification. Now, I've taken a look at what I call values now. They're what stakeholders value, what they want. When we analyze values and decide we're going to do them, we either call that the objective or the requirement or the ends or something like that. In other words, the future state that we would value. But I've observed something about all the values people mention, every one of them in the examples here, and that is they are variables. They're not binary. You don't have a secure or insecure system. You have a system with a degree of security. And the question is, how much security do you want? You might say, well, of course, we need perfect security. I said, fine, I'll give you a budget that's infinite time and infinite money. Now, hand me over infinite time and infinite money. I'll start your project quite happily. Oh, you have to have it done by the next election and you only have 10 billion quid. Right. That will limit the degree of security you can have. Okay. So long story short, all qualities, all values are variables. And to make a long story short, that means you can quantify them. You can, is in SMART methods, the M for measurable. You can put a number on it, but it's amazing how many people do not put a number on it, as in these examples I'm showing you. And I mean, right, left, and center, they never put a number on it, or as we'll show later, they maybe put a bad number on it later, but they don't really define, for example, a thing like resilience needs to be defined here. How resilient is the system going to be? That kind of thing. How vulnerable a situation, how much exposure, how extreme the event. See, on and on and on. We have these words which are clearly dimensional, not binary. And they, long story short, good planning means they must be articulated numerically to begin to be clear. And there's some other tricks we need to do to make them even more clear than a simple number, as we'll talk about. So next, yeah. So here's this same sentence from the United Nations plan, which a lot of governments and industrial organizations have begun adopting, the United Nations Sustainability Goals. And what I've taken, for example, here, we're going to build, let's see, resilience. Yeah, okay. So I've taken a set of words here and said, I'm going to build a scale of measure for all of this. And so what I do is I have the keyword saying, here comes a scale. And then I write percentage of success levels. And I've defined success levels down there. In building, I'm feeding off of that keyword. Resilience, that's that keyword. Now notice that resilience is defined as a set of things here, okay? And so is everything else. Vulnerable is defined down there as a set of things here. So what we're doing is, instead of just throwing out these ambiguous words, we're saying, yes, they're ambiguous. In fact, they are a set of maybe 10 different things, all of which we're interested in, but sometimes we're only interested in avoiding a climatic problem on family property for the physically exposed to the elements. Okay, and that's our most, so what we can do when we've defined all our ambiguous terms as a set of things is we can ultimately, as I'll show you in coming slides, we can say, what is the combination of these things that is the most critical that we would like to attain in the short term? Let's call that next month, next quarter, this year at least, not 10 years hence. And we can pick out the objectives or the sub-objectives, to be more correct, that we want to deal with early to get things done and to make sure we know how to get things done at all and get feedback on the cost and effectiveness of our strategies. So again, using the same goal, what I've done here on the left-hand side is quite detailed, so I'll not read it to you. But it's asking a whole, it's actually, this is an analysis of this United Nations set of goals, basically criticizing it. I've said this area here contains 20 pitfalls, in other words, things that could be misunderstood. And this, I've counted 28 pitfalls that we could do better in defining. In other words, it's not the rare unintelligible word we're working at. We're working at the greater mass of terminology in requirements is polluted and is a high risk that people will misunderstand. But you can use this to read this through yourself afterwards and begin to understand how bad this plan really is by any measure. So 20 plus 28, that's 48 defects in relation to the standard of being clear and unambiguous. Okay. Now, they unfortunately go one step further because they do realize that it would be nice if we could measure the progress of the United Nations and ending poverty and things like that. So they suddenly, for all their goals, pop up with targets and indicators. But to make a long story short, the targets are vague, visions, they're not clear, and indicators are arbitrary. They're like whatever the UN has statistics on, whether it's what we really want to measure or not. So this is a very messily quantified area. I called it muddled measures and vague values. How's that for alliteration? But that's all over the place. In other words, even where people do sense that smart means measurable, they do a botched up job by any reasonable criteria of clear thinking about what is the measure, what is the scale of measure, and the target, the level we want, and what are the indicators, the measuring processes we need. Problem 5, incomplete impact analysis. Okay, now again, I've taken some National Health Service stuff freely available on there's the exact URL for it if you want to look at it, but like 100 pages, long-term plan, etc. And what I've done is I've analyzed it sort of sentence by sentence. Now, where you see an underlined bold term like enable, support, make the best possible decision, those are what I call link words. And it's a clever little trick you can use to analyze bad plans quickly. Because if you find these link words which link means and ends, objectives and strategies, always, two different levels of thought, and you realize you cannot allow people to write a sentence like that for the following reason. You have a badly defined notion called better care. But we're going to enable that wonderful thing that everybody agrees to. We definitely want better care by access to medical records, which is also very badly defined, like who has what access under what conditions to which medical records would be nice to figure out. Okay, so we've already got a solution, okay, that's supposed to impact an objective. And we've got a badly defined objective and a badly defined solution, and everybody nods and says, yes, of course, sounds like a good idea. It's not a good idea. It's a dangerous idea. It should be outlawed. So there's an attempt to do an impact analysis in the sense of, here's a strategy, and I'm analyzing the fact that will enable better care. But it's not even defining these things. So the word enable, we don't know how much it enables what, when, at what cost, and what side effects it has. We just don't have enough information about the impact analysis of the proposed strategies. And the proposed strategies should never be in the same sentence as the objectives. They need to be clearly separated so that when we've decided what our objectives really and clearly are, we can consider all strategies to be potential strategies until proven that they work. And if they don't work, we need to throw away that strategy in order to enable better care. In other words, what you risk is getting locked into a bad strategy that will never work, and you haven't even figured out what to work means. In other words, what better care means. So again, here's some more detail on the left for anybody to analyze. You can borrow the slides, present them to your friends, and or at least get your mind around the fact that virtually every sentence in the plan contains these faults.
Before you go on, Tom, sorry.
Pardon?
We have a question from the audience. I don't
That's fine.
know
We'll
the name. It's just
right.
AE. I'll just unmute him. And would you like to go ahead and ask a question about connectedness?
Yes. Why are there why is there so much lack of connectedness, especially in the NHS?
Okay, I wouldn't say the NHS is especially the problem. I think you'll find that this is a pervasive problem in all public and even private planning. We haven't really sat down and asked simple questions like, should we connect all known stakeholders to an objective? I mean, you know, when was that question drafted? Has it been turned into a standard or rule or a policy? Does everybody do it? So we haven't even asked the question, what things need to be connected so that we can do things. For example, this is key to prioritization of the strategies and the objectives, is knowing who the stakeholders are, what power they have, and things like that. So we haven't even asked the question what we should connect. We haven't built the standards and taught people to follow them, and quality control that followed them. So there's like a non-starter here. Does that sort of answer the question?
Mm. I mean, with the recent COVID-19 issue occurring in the NHS, one of the things that became quite transparent and clear was that there was no clear communication, or like you say, line of command. The advice was being given, but the stakeholders, it was far away from the stakeholders, and it was too ambiguous for them to follow.
Yeah, right.
So how do you overcome that, Tom?
Sorry, what?
How would you overcome that?
That's a good, you know, in my introduction to the whole event here, I've said these are my recommendations for how we should make things better, but I'm not optimistic that the public planning will in fact get better, maybe ever. I mean, it's been rolling along like this for decades and centuries, and it's not impressively better than it was 200 years ago. So there's a basic motivational problem. By the way, the people who take my advice with a vengeance are not public service. They're actually, on the one hand, industrial corporations that are fighting for survival. They don't go out of business like Intel, or they are public service, but they're military units which are fighting for survival again, and they know that this is a life and death matter. Now, you'd think that National Health Service was clearly a life and death matter, but I've been messing and doing some work for National Health Service for decades, and you know, there's the culture has no hope at the moment. Now, if it were to have hope at all, it isn't because you, and I don't know where you are in the picture here, but decide to do it. It probably has to be a minister who's absolutely determined one day to be prime minister and make their mark by shaping up the whole National Health Service. Okay, so they would pull in these ideas, make the National Health Service function 10 times better, and say, now, why don't you elect me to run the nation? I mean, something like that has to happen. Somebody with power and responsibility has to drive the change through, and it will never be easy. And it will take a long time, and it may only happen on selected projects. We already do have some selected projects in National Health Service using my methods, but you know, they're far and few between. So I don't put up much hope. So my hope is that if I put the ideas on the table, which I'm doing now, and that somebody, at least in splendid isolation, you know, their project in Scotland on pharmaceuticals, will pick it up and do good things with it and set a good example. And maybe the meme will spread, and maybe it will die. It won't. My experience, both in UK and internationally, it gives me little hope that the people involved and the culture involved is not motivated for reasons I listed on previous slides. Because the best we can hope for in the short term is that some individuals managing their own project who have the power to do this decide to do it properly, and we have some good examples.
Thank you.
Isn't that disheartening?
It's not, Tom. I've been to one of your sessions before, and I did exactly what you said. There's things that were needed to be written, and when we were consulted for advice, we gave it, and we published the document separately, and then it was accepted in Europe and internationally. It's been published internationally for the whole world to take advantage of it for COVID-19.
Wow, Can you send me some information on that for my
Yeah, I'll send you the documents.
Thank you. Good to hear that there is hope. But it's amazing how it's just single individuals have to pick this up and say, I'm going to make this my campaign. For example, I mentioned Intel. 20 years ago, a guy called Eric Simmons went to a conference I held, and he said, I like your ideas. And he joined Intel afterwards, and he spent the next 20 years training and coaching over 20,000 engineers to use my method. He made it his life's work. The good news was Intel was receptive because it was good for business, and it was proven to work. Okay, so I'm hoping that somebody listening here will decide, I'm going to make the National Health Service, the best planned service in the whole planet, and it will be a battle, and it'll be an uphill battle, but I'm going to devote myself to it because I will save tens of thousands of lives. Okay, I'm hoping and dreaming we have idealists willing to fight for the cause and march in the streets. That's the only way change happens. It doesn't, right now, from the health minister and prime minister on down, they're not really motivated to make changes like this. Anyway, good to hear. So I'll, any more before I continue? Okay, but it's okay to take a little break like this, several times. We have of course, the questions at the end is another possibility. Okay. Yeah, so this is planning problem number 5. When we analyze the impact of our strategies, in this case, the strategy is access to medical records, we don't even define them well enough to analyze them, but we don't analyze them either. I'll show you more what I mean by analyze, but in short, it means what are the impacts on all the values and costs? That's analysis. What do we think is going to happen? There is no analysis. This is the nearest thing to analysis. Will enable better care. That isn't saying very much very clearly. Okay. So okay. Now here's we'll skip this. Here again is some more of National Health Service planning. There's the detail where you find it. Again, the first key characteristic which screams at me is almost nothing but words and very few numbers. Okay, so and I know that almost all of this are critical variables that always require numbers, and there's no reference to a tag to a more detailed specification. It'd be okay to write this if you said you want a proper definition, go to that tag, and you'll find a scale and you'll find a quantified goal, but they're not doing that. They have no such concept. Again, I have a long list of ways of analyzing this, and I don't want to read through that. I don't have the time, but I've taken a lot of time. I actually spent about 4 weeks preparing these slides with enough detail that, whether I'm presenting or not, people can get this example, get this checklist, analyze it, and present it. So you're all very welcome to borrow these and modify them and try to change the culture that way. Problem 6, I've titled it Fundamental Values. So at the top of every government or council effort, there's a fundamental value like save lives, improve health, save the nation against the enemy or something like that. Those are our fundamental values. And then to achieve the fundamental values, we need better IT systems for the hospital. For that matter, better IT systems for the military. Those are, if you like, strategic strategies or strategic things. Now, long story short, what I'm complaining about here is that the relationship between different levels of values from the top and systematically step by step down, maybe 3, maybe 5 levels, is not mapped out and made explicit by pointers, digital pointers, not least, so that we can see the connection between the visions at the top and the prime minister and the politicians and the mission of, say, the IT gang at National Health Service or Department of Work and Pensions, and then the various projects. And there is a connection, and some people will be able to point out the connection, but what I'm complaining about is the connection is not made unambiguous and explicit. And what you find is often a mixture of all of these things in one sentence. I was looking at I have to be necessarily vague here, but a home office project last week, which in one sentence had 4 levels of objectives, which none of which were defined, all of which were unclear. A friend of mine's working on that as we speak. Maybe he's listening in right now. Okay, so in other words, the hierarchy of values and objectives is not clear, and that leads to confusion as to responsibility, like who's responsible for what. You know, is it the ministerial level, the civil servant level, the IT project manager level, the supplier level, things like that. Here's a fellow that impressed me with a simple idea many years ago, Ralph Keeney. A little side story, I visited him in his apartment building in San Francisco overlooking the bay and Alcatraz. And he has his office is down the corridor from his apartment. Interestingly enough, well, everybody knows, everybody has home office today, but he literally had the same wonderful view and didn't have to commute. Anyway, that's Ralph Keeney, but he wrote a wonderful book called Value Focused Thinking, and he does a lot of public planning. So you might be interested in his book. He's got a second book out, and he consults and does lectures and stuff like that. But he had one brilliant little idea, which a lot of top managers say, wow, aha, that solves my problems. He said, look, at your level, whatever you are, let's say we're the IT gang for the moment, you have a set of objectives, and we're going to call them strategic objectives because they're at our level. Now, below us, we have some requirements for a sub-supplier like Accenture to build a system for us. Those are called means objectives. That is, if Accenture builds a secure enough system for us, they will support our objectives of generally having secure systems or something like that. If we build this, meet our own objectives, we will serve the interests of or support the fundamental objectives of good health to the nation. Now, the first time I looked at it, I said, ha, he's only got 3 levels. I have real projects with 8 levels, so I'm numerically better. But then I had a second think, and I realized something very simple. This scheme applies even if you have 100 different levels up and down a gigantic international hierarchy, and United Nations sustainability goals are a place where that's going to happen. Once you've got this idea, you can say, well, what are my objectives, my responsibility? And then what am I delegating to other people? And what am I serving? And so this is not my responsibility. This is my boss's or my organization's or something, a God or something like that responsibility. So it's a wonderful little idea for sorting out my responsibility, responsibilities I delegate, and masters I serve. And in the middle, we have constraints, which I won't get into just now. Here's this confusion of levels. I've just used the arrows to indicate how things are connected, and I won't get into it in detail, but you can analyze this and say, aha, there are different levels here, but they could have been a lot more clear about, number one, they could be clear about what these things are. We still have all this mumbo jumbo: to increase, link word, deliver services, link word, which meet the needs of their jumbo communities. What does that mean? So you still have all this undefined ends and means confused, but you do also have a discernible hierarchy through analysis. I'm not saying we can't analyze the hierarchy, but I don't think we should have to analyze it. I think it should be spelled out in no uncertain terms, that here's a set of levels which is the minister's responsibility, and here's a set of levels which is NHS IT responsibilities, and here's Project X responsibilities, and that should be digitally unambiguous and clear. Now here's an example. We'll see more of it when we get into the principles, but here's an example of hierarchies. So this is actually from a BCS course we did with exercises, the workshops, and we decided to work on pollution in London, which no problem. If you get COVID, solved that problem, right? Well, no congestion probably, and no pollution. But anyway, so here we have a digital tool which is keeping track of things, both in terms of the top strategy called advanced congestion charges. Here are the set of top strategies listed, by the way. Here's the advanced congestion charge. And then we've decomposed advanced congestion charges into a set of sub-strategies so that we can deliver some of the higher priority ones early and get some results, get some experience, and avoid large-scale failure of our projects. And here we decompose this strategy digitally. So each one of these is a digital specification and entity on its own. But we have, since we have the following levels, we have the notion of all the strategies for some effort. We have the next level is the decomposition. It's this set of strategies we're talking about. And then we have a further decomposition of any one of the strategies. This is like for week by week, month by month, or quarter by quarter implementation. But both in terms of what we can diagram and what we can do digitally, the hierarchy is extremely clear and pinned down, no mistake about it. Advanced congestion charge is a part of what is known as top strategies, which could have any number of levels above it. And but it consists of, and these are the levels below the means strategies, if you like, or means objectives. Okay, so problem number 7, and no, almost en route. So the public access. Now, the government's been pretty good at trying to make things accessible digitally, worked very hard at it. But the problem is, when I look at what is accessible, we're using the NHS as an example, but we could use almost anything. What is accessible is certainly not the whole story. In other words, all the debates that happen, the minority opinions, the extra detail they didn't think was worth presenting to the public, that's gone. That's not available. There is no link to it. Usually, there's no hint that there is a link to it. It's perhaps not digitalized at all. Perhaps it's just a note or a memorandum during a meeting. Now, I believe that everything behind a plan, including bad plans, rejected plans, plans only supported by the minority, need to, and all the detail around the plan, like all these different sources, they need to be available to the public and to the media in principle, as let's call it Freedom of Information Act or something like that, so that a journalist can dig down and fairly criticize something as, for example, not being a true reflection of the source it claims to have come from, or not being a true, or being done by research people who didn't do proper research. Media should absolutely be able to dig deep, and any member of the public who says, I'm angry and I'm going to fight this and I want all information on my table, they should have it. That should be a legal principle. It probably is at some level, for sure. But we still have too much information that is inadvertently withheld, is a nice way of putting it, from the public. And therefore, for example, I cannot review or quality control the NHS plans. There's not enough information for me to do it and give fair criticism or discussion or debate about the program. So problem is really digital access to anybody if it's not declared to be secret and confidential. Problem number 8, let's call it stakeholder mapping. We have an IT culture which is, for the moment, reached a stage of maturity which says it's not all about writing programs anymore. We've got to be user-centric, write use cases, user stories, and be user-friendly. That's good, except what about the other 49 stakeholders? Okay, so we need to be stakeholder friendly. We need to write stakeholder cases. Okay, user is just one small set of really critical and important stakeholders. For example, the government law is not a user, but it's a stakeholder of most of the public systems. And it has an opinion about what you're allowed to do, for example, with regard to personal data and medical data and things like that. So one of the things people miss totally when they even think stakeholder is they don't realize there are inanimate stakeholders. In other words, laws, regulations, plans, policies, guidelines, and standards. and they actually require our systems to be built in a certain way. And they're as powerful, if not more powerful, than a minister with an opinion. And they may be more permanent than that minister who may be out on his ear next week anyway. So we need to be, now there are certain disciplines, I would say space and military and systems engineering are good examples that are really pretty good at doing stakeholder analysis and stakeholder mapping. And some parts of IT are sort of beginning to do it. And I looked through the BCS book publications a while ago, and I found, every 10th book that should be talking about it was talking about stakeholder a little bit rather than not at all. But we've got a long way to go before we're as mature a technology as those who live and die with their technology, the space and military people. They've long since understood that deep, thorough stakeholder analysis is a necessity for survival. And all civil service planning is big enough and affecting the lives of people enough that we deserve much more thorough stakeholder planning than we have. Okay, here's a little, I did a little course. This is in March, just before the crisis fully hit. And I did a workshop of the same kind I do with British Computer Society in Oslo. And we decided to do COVID-19 planning just for fun. So here are some of the stakeholders we had, and here are some of the values of the stakeholders. And then, of course, we are connecting, this stakeholder has at least 2 values, this has at least 2. Now, but interestingly enough, here's a value with no stakeholder, and here's a stakeholder with no value. Isn't that interesting? By definition, stakeholders are not stakeholders unless they have values. And values are not official values unless they have stakeholders. So we're the digitalization and visualization analysis enable us to spot obvious, serious, potentially serious problems in our planning of the COVID-19 before the onslaught hit. Okay, here's from the same thing. Where since we're using a digital tool, we can display information in all kinds of ways. Here's the stakeholder list, and by clicking on Health Minister, we automatically get highlighted the 3 values and resources that somebody thinks the health minister is particularly concerned with. Or looked at another way, if we have a health minister a stakeholder record with all manner of information, and but one of the information is the links to any other specification, which is these same 3 things. So this is a way of modeling the stakeholder plan problem digitally and displaying it in useful ways, selectively useful times. I think all public planning ought to have resources like this, so it's easy to make connections and keep them digitally up to date throughout years of planning and replanning and changing things, keep things up to date. Here's a little generic map of types of stakeholders. Weak victims, they're the people the council looks after, or the people who got a COVID-19 disease, right? Antagonists, those are actually foreign tourists who bring COVID-19 into the country and spread it at a pub, okay? And defenders of weak victims, that's the National Health Service and their gang, right? So these are different interesting classes of stakeholders, and here are some detailed examples of them. Here's a little bit more enlarged over here. So you could use this as a checklist of potential stakeholders for your public service projects. And I think any one large public service, such as defense or environmental, they need to have a good stakeholder list, which generally occurs in all the plans they do. And they need to understand and learn about their stakeholders and reuse, if you like, these ideas to the degree they're applicable in their different projects and efforts. Over here, just for fun, I have some stakeholder attributes. That means quantifiable attributes of, for example, the power of a stakeholder, the wealth of a stakeholder. They help us determine the priority of a stakeholder. And here are some stakeholder management strategies. This is, if you like, advanced stakeholder theory. I'm sort of thinking this summer, maybe I'll write a book on stakeholder stuff. It's on my list of 5 books to write this summer. Here's a cycle of planning, and notice it doesn't say users, it says stakeholders, and it doesn't say requirements, it says values. but they're requirements and objectives. And it doesn't say designs or architecture, it says solutions, very generic, but this is what we want to do for the stakeholders, and this is how we want to do it. Decompose says, in order to be agile and deliver things in incrementally and early, we need to decompose big solutions that would take 2 or more years, for example, and 1 billion, into smaller entities that can be delivered and do some good somewhere as early as possible. And then we need to measure how it works and learn whether it's premature to scale up that solution or not, like to all councils or all counties. And we need to learn by maybe changing the strategy and going through another cycle of making sure that the strategy works better than advertised. So this is a plan, do, study, act. I'm citing Deming and Short, plan, do, study, act cycle here, but it's a slightly more advanced version. We call it the Gilb Evo cycle. Okay. Here are 10 stakeholder principles. I don't have time to go through it, but I wanted to supply it to you. I'll tell you what this says. Stakeholders are very complex, very dynamically changing, very uncooperative sometimes. They're a problem, but you have to deal with them, because if you don't, they will deal with you later, leading to the firing of the minister or the IT chief for NHS or something like that. So take your choice. And by the way, I'm focused on critical stakeholders, meaning they can kill your project, and critical values, meaning non-delivery of that value can kill your project. The non-critical stuff has lower priority by definition. Now, I should be about halfway through my talk. I'm not really that, but I've got another half an hour anyway, and that should allow me to get through the planning principles. And I've already really talked about some of them, so I can skim over it. But that's my analysis of the situation. And if you say, I recognize that, that's how it is with us, before at least we went on Tom's BCS course or something like that. So what are we going to do about it, Tom? And I've already given you some broad hints, but here's a list of the top 10 public planning principles here, and I'll go through them and hopefully get through most of them by the time we're done. And if I don't, there's enough text to figure out the rest of them. Here are some pointers to on one of my tools. How do we do strategy, definition, stakeholder values, and critical resources, etc. So principle number 1. Critical values, like not too many dead COVID-19 patients per day, please, are going to be critical. We don't just say we want to reduce the death rate. We need to say things like, within 4 weeks of the discovery of a virus, the death rate in the country shall be no more than 1 per day maximum, or something like that. If you sort of fake it and say, well, we want as low as possible, and in fact is 1,000 per day or 10,000 per day, and you say, well, that's as low as possible, says Trump or somebody like that. Not good enough. We need to commit to the possible, like levels that other countries have done with effective shutdowns. Might be an interesting way of deciding, what are our goals here. But long story short, critical values need to be quantified. So here's the critical value: drastically improve the air quality in London to acceptable legal levels. That's the kind of thing the mayor might say. That's okay, we can quote him on that. But what is the scale of measure? And what about the number of persons who reside in London boroughs dying from exposure over time to blah, blah, blah? And how are we going to measure it? Recent hospital records for London hospitals. And how bad is it today? And what's the minimum we want to achieve within 5 years and 1 year, short term and long term? And what's the successful level we want to get to by 2028 or 2029? And what's the stretch goal in our dreams, if we could possibly achieve it in a cost-effective way? How good we like to be? How about 0 deaths per day or something like that? And who are the stakeholders? And this is, by the way, student planning in a BCS course. Just so you know how we train people. We train them by getting to do projects like this in, for example, public planning. So principle number one, critical values need to be specified clearly, comprehensively, unambiguously, measurably, and this is a practical example of doing it. Now, here's the general I thought I was talking about a little bit earlier when I talked about the U.S. Air Force General. This is Brigadier General Jeff Sheldon, and he invited me over to Wellington. I was training some of his people at Wellington Barracks, and they sent me up to his office for tea at about 5 o'clock. And he said, Tom, what can you do for me? I'm the general. And I said, I can help you quantify any critical variable that you are planning. And he said, well, that sounds like an outrageous claim, but it just happens that I'm working on planning of the communication systems for the British Army, soon to be deployed in Afghanistan and places like that. And I've got something I know is important, but I don't know how to quantify it, and it's called coherence. And so we over tea, quite literally, in the hour, we started with his ambition level, made him the owner, in other words, the owner of the specification. He's empowered to change it or not. Said this was a complex objective. We versioned it. So you see when this is 19 years ago. Ultimate status was, we went on to other things, but we were just demoing it could be done. We pointed upwards and said this coherence supports other objectives like productivity, resource efficiency. These are tags to very well-defined higher level strategic or fundamental objectives, depending on it. Okay? Now here, we then pin down the scale of measure, which you can read using scale parameters. So we can define applications, we can define conditions, define staff, define environments, define tasks. And you see some example of what we did define down there. Decide how to measure it in practice. Say how bad we are at the present moment and how good we want to be in the future for very specific, like the tasks or operational planning. The environments are brigade headquarters in the desert, and the staff is SO3 captain. I have no idea what SO3 is, but that's what he said to me. Now his immediate reaction was, well, here it is in writing in a letter he sent to me shortly thereafter. Extremely grateful for your work, resulting in major revision of our digitalization methods. The methods you have developed were exactly right for that purpose. That is a senior, may I call him a civil servant, even though he's a general, fully appreciating the value to him. And these are the kind of people that say, you know, we will do this. We have to do this, or our soldiers will die in the field. That's simple. They take it dead seriously. They don't pass the buck. Okay. I love my generals and admirals I deal with. They always appreciate this stuff. And I wish the rest of the civil servants took their business as seriously as the generals do. But maybe the other civil servants haven't been in battle watching their friends get shot dead. I don't know what the problem is. It's called motivation. I talked about structuring, say, a requirement or a specification. And these are, now here is, for example, the core specifications, the requirement itself, but with quantified stuff. Here's the background, like the stakeholders. This is other types of things we need to attach to the specification so we understand its relationships. And here's administrative stuff so we can change it and version it, know who's responsible and know who the expert is and that kind of, and what status it's in. So all of this needs to go into one single objective and one single strategy. And we have to make up our mind about how complete, you know, which ones of these have to go in a requirement and which ones of these have to go in a strategy and things like that. And then demand by having a template, a digital template or something that people fill out the form, put this stuff in here and just don't write nice sounding words. Will help us get some nice sounding words. That's childish and dangerous and really you should be thrown out as an irresponsible civil servant if you do it. But unfortunately, you can blame the minister for the moment, and we have to throw the minister out first. Principle number 2, critical resources. So here's the bottom of a very large table with a whole bunch of values up there. I've shown you some earlier, I'll show you some more. But at the bottom of the table, we have a set of defined scarce resources, capital, cost, time, staff, and maintenance costs. And these are, we have limited resources. We don't have infinite money, infinite time, infinite people, and infinite cost to keep the system alive. So there's a budget there. Now, every strategy you suggest, we need to cost it. We need to estimate to the best of our ability, giving evidence for how we got there, the degree to which this will eat up our budget. This eats 14% of that budget. This eats 9% of that budget. This eats 0% of that budget, right? And so we need to have a fair and complete idea of both the short-term capital cost and finish the project, and long-term keeping the system alive and manning it, resources. And we need to know what those resources will be approximately and reasonably before we commit to the strategy. Now you look at all the plans I've shown you in National Health Service, there is no indication that anybody has estimated for costs like this for each and every individual strategy. They all have their individual cost estimation. It isn't a matter of saying, oh, the whole project will cost, take 10 years and consume 10 billion. And everybody knows it's going to take 20 years and fail and cost 30 billion and fail. You need to cost things at the individual detailed strategy level so you can prioritize those strategies, other things being equal like the values, that have the lowest consumption of limited costs, okay? So, by the way, if all of these strategies are to be adopted, this one and this one and this one and this one, then you should be able to sum up and say, aha, we're using 21% of our budget. Aha, we're using 52% over budget. Aha, red means you have a safety margin. You're just not allowed to plan to use more than twice the budget, and they've done exactly that. So we've got a safety margin number we've decided on, factor 2, and the red says you've blown your budget. You have to go. We've blown it gradually. You can see the increment. We're going to do this first, that, gradually work up to budget is blown. Okay, and we need to back down and say, right, well, let's start there. That's too darn expensive. Is there a less expensive strategy for doing this so we don't blow our budget before we even start? Okay, so long story short, I mean, doesn't it sound like good common sense when you're spending billions of the taxpayer money, and if you're late, the disease will kill 50,000 people within 6 months? Doesn't it seem like a good idea to worry about time and money up front with the best estimations possible? And when you find things are threateningly expensive, you change your strategy to less expensive strategies. That's known to engineers as design to cost. Find a cheaper strategy. Good engineers can always do that. Now here's planning for making a nation great called Poland, and it's a class exercise there too. But so here are some values: better education and health and things like that, quantified. Here are some strategies, and here are some costs. So the point is, we need strategies that have good values in total at low costs. And this is called an impact estimation table. And we're estimating the impact of this strategy on reaching this goal, moving from the status to a wish level to our plan, and say this strategy gets us half the way. And this other strategy also gets us half the way, and maybe the combination of them gets us all the way, but we don't know that. We probably have to plug one in and then plug the other in and see what happens to find that out. But this strategy is, let's see, sorry, this strategy, oh, the strategies cost the same. Okay, we won't go there. The point is, we can take a look at the values and the costs in plural, the main effects and the side effects, and all the interesting short-term and long-term costs in looking at any strategy. Now, we don't have to publish this for every citizen to look at, but we do have to use it as a tool to make better plans for ourselves in the first instance, and to justify, present, and defend a plan in the second instance, and to revise a plan in the third instance. We need this level of detail, okay? So here's another simple example. I'm trying to do it graphically. Here's some value Here is the, gotta move my webinar window out of the way. Here's some value I want to achieve, some improvement in my objective, and strategy A, B, and C all get me as far as I want to get. So they're all good enough to achieve the value. But if I take a look at the cost, and here's my budget limit, strategy B exceeds that limit. A and C don't, but A is a good deal more expensive than C. So all other things being equal, and in this simple model, they are equal, I need to choose strategy C as having the best value for money. We actually let digital systems automatically prioritize strategies by looking at these numbers and automatically deciding what the best value for money is. By the way, value for money was Cameron's election slogan, because I tried to advise his people on how to quantify all the values, which they said they didn't know how to do, but it was a good slogan. Okay. Let's see. What am I? There we go. Okay. Keep going. Eye on the watch. Fine. Principle number 3: stakeholder value. The principle basically says that we need to, and I've sort of been through this before, this is just pinning down the idea that all values are stakeholder values, and we need to specifically identify which stakeholders need them. And we might have 3 different goals for 3 different stakeholders for the security value or the customer service value. You don't have to compromise on one value or the maximum value for each and every stakeholder, but you do have to listen carefully to what the stakeholders want, why they want it, what value they have, and then come up with a specification that as best as possible delivers maximum of value to the stakeholders. You can't satisfy all the stakeholders and all of their dreams, but you can try to maximize the value for the time you have, the resources you have, the budget you have. But you have to do this quantitatively. This is from the United States Army system, and this is a real example which they let me publish. Here's another US government example, but this happens to be an extremely large government bank. They were doing balanced scorecard planning, and they were extremely frustrated, just about to cause the recession, as it turns out. And I walked in and I said, well, I can see why you're frustrated. You've got all these bullshit terms like, we need to enhance our capability of extending our services to products and markets we do not currently serve. And they said, what do you mean? And I started explaining to them that they needed to define enhance and define capability and define extending and define services. And we did that. And they said, oh my God, that's why we've been frustrated. That's why we've been fighting each other. And in fact, my son Kai and I were flown into Washington the week after to spend a week with these people. There is a detailed example of everything we did in that link if you want to take a look at it. But the problem with the balanced scorecard is that it's not balanced. It still quantifies all the financials, and it doesn't quantify or insist on quantification of the non-financials. But they still teach this bad example of dealing with values, non-financial values, at business schools. I did find one British insurance company, which is at the end of this set of slides, which did indeed quantify all the non-financials very well. So in spite of the bad American academic advice, the British figured it out better. Let's see, this diagram I already showed you so that we can avoid, and the 10 stakeholder principles, again, certainly no time, but what I'm trying to say here is they are many, they are tricky, they emerge gradually, you can't get them all at once. You're gonna have to change your idea of who your stakeholders are. You're gonna have to change your idea of what values they want. They will change their minds. They will be forced to change their minds. There's a constantly changing, complex, voluminous picture of the stakeholders, and we have to handle that. And if we can handle something as complex as IT code, surely we can handle a list of 50 stakeholders. But we're not trying now. Okay, so do that. And so principle number 4 is about the strategy definition. Now, again, I I showed you many examples of strategies. So we're gonna do a strategy in order to attain an objective. Okay, and you'll notice that all the examples I showed you are 1, 2, 3, 4 words. You know, we're gonna build an IT system so that everybody's happy. What you find in typical user stories is a very good example of lots and lots of things we're going to do in order to make things better. What we need to do is we can take a user story. By the way, that's what I call an ambition level, a user story. And we need to detail the solution. How much do we have to detail it? Well, in very simple terms, it has to have enough detail that we reasonably understand what it will cost and how effective it will be at delivering our stakeholder values. Reasonably, plus minus 30% would be fantastic. Okay. We are wrong by orders of magnitude about these things. We don't have a clue. We dive in and screw up and spend money and spend time and try again. Okay. And one of the reasons, one of the many reasons, is we do not detail our strategies as well as, say, a building engineer might detail a blueprint and parts list for a building. That's the analogy. Engineering is the analogy. Serious engineering doesn't throw out 2 or 3 words, they build me a nice secure building and hand it over to a carpenter. They go through a process of detailing the building strategy so that they can do cost estimation in a reasonable way, and they can understand the say the security or the strength or the environmental protection of the building. So that's the analogy, and that's why I'm talking engineering here. We have to go beyond the user story level, which is fine as a top level simplification, top level summary, something from the minister, no problem there. We have to go beyond that in serious planning for the large government and communal projects we're talking about here. Let's see. Okay, now here's a little model. By the way, I've worked out some planning icons, plycons. Here's some detail on that. Showing you some for the moment, but so here is a value. Here's a fantastic, perfect security. Here's no security whatsoever. Here's how good our security is today. Here's how good we want our security to be in the future. Here is a strategy for getting better security. The NHS was hacked recently, remember that? Shut down a few hospitals. We need better security there. And I'm sure they knew that before they got hacked, but they obviously put in security measures that only went halfway, and the hackers are always looking for the gap there. So here's an evaluation of a strategy that it'll improve security, but improvement is not enough. We have to have sufficient improvement so that 99.9% of the hackers just don't get in. Now, if I've got this strategy and I rate it as having an impact of 50% of what I need, I've got a gap here. The gap is a strategy gap, a design gap. It says I must either improve this strategy so that it is twice as effective, or I must add another strategy which brings me from this point to the future point I want to get to. So in a way, I'm using this to define the idea of strategic planning, or define the idea of planning at all, because planning is, in all of our government institutions, all about increasing values, finding strategies, understanding as early as possible how good or bad they are, and as early as possible finding better strategies before we start talking about the cost is that plus that, not just the, costing it at this level and then discovering we really need to do this means you're going to have a cost overrun of factor 2, doesn't it? And that's kind of stupid when you could have spent another week figuring out that there's a 1 billion quid extra cost here. That might be worth a week of planning, and we need to do that. Anyway, so that's just a graphical way of understanding the whole problem of planning as far as I'm concerned. I gave a simple example of a solution idea. Here, this is just the summary, and it's about 20 lines long. And this is a description with no summary. But in short, we're looking at about a page of detail, generally speaking. In other words, 10, 20 lines is probably what's going to give you enough detail to understand a cost within plus minus 20, 30%, and understand the value it can give. A one-liner or one word or two word thing will never do the job adequately, because the variation of what it could do cost-wise and value-wise is just too big to stomach responsibly as a civil servant planner. Okay, so there's some more. See, there's our cycle, and there's the strategy identification. These are, if you like, big ideas. Some would call them architecture. Here are the three strategies used for the national health system: pharmaceutical, from supply cabinets to the patient, real implemented system at national health, and to people who actually gave a lecture for the, if you remember, Margaret would maybe remember these two, Manchi and Ravinder, gave a lecture about their use of my method at the Quality Group, British Computer Society in London, and there's one of the papers on it. But here they are using the method to clearly understand what the National Health wants to do, to take a look at some of the suggested strategies, to estimate how good they are, and to use this information to decide what to prioritize, what to do, and what not to do. One more advanced step, which is not for everybody, but and it isn't a step I think they took here, but I think much larger projects like the COVID-19 crisis or Brexit, I think when you're making estimates, I think you ought to drill down. And normally there ought to be a standard that says, okay, you've estimated 70% impact. What is your evidence? Write it down digitally and capture it in the cell. What is the source of the evidence, so I can check that you're not falsifying or misinterpreting the evidence when I do a review? That's called quality control. These are risk management ideas. You said we're going to save 7 minutes, but could it be 4 minutes or could it be 10 minutes? In other words, is it 7 plus or minus 3? What is the range? You probably cannot know what exact number it is. So this is an example of diving deeper and forcing people really to plan more seriously. The moment you demand evidence, demand sources, you're driving up responsibility, accountability, traceability, ability to do reviews, and quality control. And any serious plan, like for COVID-19 or military plan, nationalism should absolutely be doing these things every time in evaluation of every plan, at least at the top level. That's my not so humble opinion.
Sahir would like to ask a question.
Yes, Sahir. Oh, and we've got 2 more minutes, but but go ahead anyway.
No, hi. No, after we finish.
Okay, so I should at this point I should round.
I mute myself, yeah.
Yeah, I should round off. So I've got some other principles, but no more time. However, it is written in such a detailed way that here's actually really planning Brexit in practice, by the way, using my methods. And here's some other stuff, but we've seen a bit of it. It's about quality control and review and stuff like that, which we don't have time. But I've talked about a lot of this stuff on the earlier lectures we've done, and which are posted as videos on the SPA site, so you can catch up on them. So let's just say that's all we could do within an hour and a half. I did. Okay, so let me wind up here. Just for fun, when I took a look at that civil servant idea of ethics, I thought, what kind of ethical principles should a civil servant actually have? What should we demand of them? So I wrote my own, and you're welcome to copy it, modify it, use it, hopefully not misuse it, set of ethics principles for public planning. All critical stakeholders, that's the limit, will be identified and analyzed. All critical stakeholder values will be analyzed and quantified, etc. So that's a summary of the whole talk right there. And you should be able to present this to the minister or the chief technical officer of the National Health Service and say, let's have a discussion whether we want to insist on these things being done. They are the standard. Violation of them is unethical, waste of time, embarrassing for the service, and we can't do it anymore. Okay, so this could be a focus of a discussion. If anybody does implement this in any shape or form, I just brainstormed it for you just now for the fun of it on June 11th, let me know. Be kind of fun. So this is an explanation of why I use the term engineering. I've referred to it a bit, but I believe anything large and complex, like most all government and even large cities planning, it requires what all large complex projects require in the rest of the world, and they require an engineering process for handling large complex systems. And here very specifically is some of the engineering content. This can be a symbol of it, and my free book for you, the Competitive Engineering, contains the engineering techniques that can be used for public service planning. That's a free set of standards you can use right there, and 144 principles of good planning. Here's the free book with 100 tools, practical tools for planning. So nobody's going to adopt everything I say overnight, but you might like to adopt one idea and try it out on your project. Try to quantify one obviously critical goal by the time you get to work tomorrow morning. And so here's a little toolkit with 100 tools you can pull out. And by the way, this toolkit is actually secretly a very high-level simplified view of a much larger book called Value Planning, which is right there, which is 700 pages. So the BCS refused to publish it since it was too big. So this is the shortened version. I haven't offered it to BCS. Anyway, end of talk. Not too bad. Given questions, actually, if we subtracted the question, I've done it in 90 minutes. So there's the book. There are the slides. We'll get a video of this. I'm looking forward to hearing what has been practiced from people out there who have learned from me earlier. Don't be shy. I'd love to collect ideas of what you've done. And I'd love to know where you're stopped, where there's a bottleneck, and maybe suggest how to get past it. So don't hesitate to contact me. I have a very soft heart for hospitals these days because I'm pushing 80 years old, and I'm suddenly having massive doctor's appointments and hospital appointments all around the place, and I never went to one of those things in my life. So I'm getting very interested in government-run hospitals and how well they've planned to do things. So end and into comments, discussions, suggestions. I'm listening.
I have unmuted all the people who are still present.
Okay.
So if you want to ask a question, I think Sohail was first.
Yes.
We can probably hang on for about 10 minutes.
Well, I mean, for me, I mean, afterwards, because I'd like to tell them about next week.
Okay. Well, tell them about next week now, so you get it in.
Well, next week we have another event for business change.
Yes.
It's called Crazy Thing, called Change. And the speaker is going to be Eileen Roden.
Right.
She's a good speaker.
Yes.
And I'd like to talk to you, Tom, afterwards. I mean, I'll contact you later.
Okay. Yeah, we know how to contact. I've already signed up for her session, so I'll be there if they don't call me in for a hospital. Yes. Okay. So, any questions or remarks otherwise?
I'll just mention also that next Wednesday, the 1st of July, we have a speaker called Dr. Quan Hon, who's going to tell us all about GDPR, which has now been enforced for just over 2 years.
Ah, good. I don't remember getting an invitation to that. Is there a reason for that?
Yes, you did, and you replied to it.
Then I don't remember. I'm getting too old to remember things like that. Okay, let's put this in my calendar and I can attend. Thank you. I'm very interested in GDPR. We've, my friends built a tool in Norway, as in many countries, they built their own Norwegian tool, but they really didn't look into GDPR and things like that. Some of my other even more intimate friends, technologists, IT people, got very, very angry at the invasion of privacy that the COVID researchers wanted to do. And they wrote it, and they published and signed a letter of 80 top researchers and said, basically, you are unnecessarily violating personal human rights and GDPR, and it's illegal, and the benefit of this doesn't outweigh that. And so finally, the government backed down, dropped the whole tool, and decided to split the tool into two. The parliament itself decided to split the IT tool into two, so you could opt into being researched on in more detail if you wanted to. So there's an example of IT people. And I got a letter from Johannes, one of the guys there. He said, we made this point before they built the tool, but they were in such a hurry, they didn't listen, they didn't care. They just programmed it and said it's ready. And half the Norwegian population signed up to that tool and downloaded it for literally no use whatsoever. So there's a pretty silly IT project, if you ask me. I understand they were in a hurry, but there's something called being in too much of a hurry.
Thanks very much.
Excellent. Thank you very much.
Well, if there are no more questions, then I'd like to thank Tom once again for offering up his time and his expertise. As you say, there's a lot of preparation that goes into one of these 90-minute talks.
4 weeks of several hours a day for this one, if you want to know. I refined and refined and refined it.
That is amazing. And, you know, at your age, you'd be perfectly entitled to sit back and take it easy. So we're really all very grateful.
At my age, you got to have a bit of fun.
Absolutely.
This is fun.
Okay, there's a few more questions on the questions panel. How do we obtain the slides? Any other advice for business students?
Okay, yes. Now, I have in my value planning book, which I will send to any business student for free, I have a section on what I think students should learn. And I'm afraid universities are not very good at it. But I've written some papers on it called Undergraduate Basics. If you were to Google Gilb Undergraduate Basics, you'd get the paper, and I'll send it to you on request. But I can summarize in 3 words almost. I believe that universities need to teach stuff that has a long half-life. In other words, it will be useful and valid 30, 60 years from now, the rest of your professional life. And I think that was the original purpose and original practice of universities. They did that, but we've gone narrower and narrower. Now we're almost, giving doctoral degrees on how to program, so you get a job the next day. We need to teach people how to think about complex government systems, among other things. So the 3 things I've identified that should be taught better. Number 1 is what I call principles. Like, you cannot analyze a strategy if you don't define it in more detail, which I talked about now. That's a principle. And we need to learn that principle. It applies to everything that anybody plans anywhere, but we're certainly not very good at understanding it in National Health Service planning and government planning generally. In the competitive engineering book, there are 144 stated principles, count them. And in the value planning book, which I gave you, there are 100 principles. There are actually 100 subchapters, every one of them with a principle. So I give you the principles that any teacher could use to hold a sermon every Sunday on one principle. Now, the second thing is very simple. Teach students the ability to measure anything, even if it hasn't been invented yet, like security, personal protection, flexibility, user friendliness. These things weren't even on the agenda when many people went to university, and nobody got taught a specific method for doing them. We can't teach people specific methods like how to measure speed or brightness. We can't teach people specific methods for things that are not on the agenda yet and haven't been invented or not concerned. We have to teach people the general method of how to find scales of measure and measuring tools for absolutely anything that pops up in the future. And we're going to have a very high rate of change We're going to have hundreds of new things that concern people, and university graduates at least need to learn how to define scales of measure for absolutely anything. Okay? I refer you to one of the lectures we held for BCS called Sustainability Planning. There's a video of it. It's at the SPA site. I wrote a book on it. It's free. Did the video. And that's an example of quantifying all the United Nations sustainability goals, for example. And that's also government planning, very much so. So it was, but the United Nations hasn't learned to do that yet. We need to train people who can quantify, and that means to manage and engineer and understand absolutely any variable value that comes across. And we're not doing it. And the third thing is to learn conceptual clarity. A very simple example. If you read the plans I've been talking about, and you see this link word, which means there's always an objective linked by a link word to a strategy. And it's under the heading of objectives. In other words, under the heading of objectives is a strategy, which is not an objective, okay? Obviously, somebody doesn't understand terminology very well. If they put as a heading a strange mixture of objectives and strategies, I wouldn't mind. But they say objectives, and then they've got one finite, bad and badly defined strategy in there, okay? Now, what's my point? My point is we are very bad at conceptual understanding, like what is an end and what is a mean. There's a quotation in some of my slides from Einstein saying basically the world is very confused about ends and means, and they still are, and they are at the National Health Service and in all public planning. So in other words, so my third element, we need to get conceptual clarity. In my competitive engineering book and in other sources, I have defined in my planning language 700 concepts, and they're all defined with respect to each other. And they're things we need for planning systems like objectives and strategies and things like that. And so my observation is the professors do not have themselves conceptual clarity because they never got it from their university education, and they're not teaching it to the students. And so we're graduating people who have something is, I think it's my wife's iPhone is alarming. Okay, forget it. Okay, so okay, so they're muddled in their whole thinking because they don't have conceptual clarity. They are using words which are not defined in advance in a standard glossary, and they're not defined specifically, as I showed you in those scales. They're just words, you know, that anybody can define in 20 different ways, and everybody will do it differently. Okay, so conceptual clarity, one tool for conceptual clarity, but also for many other things, is quantification and measurement of everything and anything that is critical, even if it's new, even if there's no 200-year tradition for the volt or the ohm or miles per hour. And then the first thing is the idea of basic principles. There's a guy called Harrison Emerson, who I quote in some of my slides, who basically says that methods are many, but principles are few. And the person who understands principles can better choose their methods, okay? So in other words, principles are the few core, key, powerful, eternally valid ideas. They're almost laws, which can help us select new methods for new problems. And university graduates need to learn those principles. And I offer you, I've got a few hundred principles in the books and just about everything I do. I gave you the principles for stakeholders in this lecture, for example. Okay, so that's what I advise universities to teach their students. And I put this in writing, and anybody who writes to me and said, Tom, send me that stuff for students, or I'm a teacher, send me that. I'll be very happy to email it on to you.
Let's call it. Thank you very much, Tom. Do join us next time. And
I will be there.
Thank you very much.
Looking forward to it.
Thanks for inviting me. All three groups. Okay, business change and quality and SPA. Okay.
Yeah.
You're having a wonderful week with a conference SPA this week, right?
That's just
No.
BCS actually. The conference. That's
It's larger. It's a BCS.
1 hour each day from 2 p.m.
Right. Okay. I'm going to join on Thursday when I've done with the conference I'm doing Monday, Tuesday, Wednesday.
Good for you.
Okay. Last orders, gentlemen, please. So you got my email down at the bottom left. If you want to ask questions by email, I'm really happy to hear from you.
Okay. Bye-bye.
Bye-bye.
Bye-bye.